Hi, it's Lauri Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore, Maryland. So, people who are concerned with some neck issues and they have some jowling, again, those people who are kind of in that 40, 50-year-old range where they're starting to see the aging process, the laxity occur, and their focus is majorly on the neck, but they still are having some laxity in the face. An ideal combination of procedures for that is actually doing what's called a neck lift, which is a platysmoplasty, bringing the muscles together and resuspending those muscles from ear to ear. I actually make the analogy is that if you had a hammock sitting along two trees, and over the 40, 50 years that hammock is sitting outside, it's going lower and lower to the ground, and it's widening, and the fat of the face is falling on top of the hammock and below the hammock. So when you want to straighten up a hammock, you'll untie it, restring it, and give yourself a new hammock. Well, that's what Dr. Kane is basically doing when we call a platysmoplasty, is taking the hammock of your neck, resuspending it from ear to ear, and then he also adds a suspension suture, and that gives you this nice crisp neck, which is what he has done for me in the past. And it's a new neck structure. And then he liposuctions the jawline and all the area around the neck, and then he lays the skin back on to give you this really nice neck. With that procedure, there's actually no removal of skin. There's no real cutting at all around the ears. It's just a small incision under the ear and what we call two tiny little incisions, not even an incision, just enough to get his instruments in behind each earlobe. So that is perfect for the neck without major, it is surgery, and you are going to be put to sleep under a local anesthetic and IV sedation, but there's no major cutting with that. Then, if you have some skin laxity to the face, we can always add threads in at the same time. So it's a perfect combination to take care of the neck problem, lipo-contour, lipo the jawline. A lot of people feel like their cheeks are too full and it goes into their jaw, and they really do lack that nice kind of curvature in that lower jawline. So he lipo-contours this entire lower face in addition to the neck, in addition to the platysmoplasty, that gives you this beautiful neckline and new jawline. And then if there's any issues of skin laxity, that's where we put the threads in at the same time. It's a really nice combination for those transitional people who are seeing changes and they want to do something, maybe something more than just a thread lift, but they're not ready for the full facelift. So this is perfect. If you're interested in having a consultation, please give us a call, 410-602-3322. And you can always look at our website for photos, drdeankane.com. All right, give us a call.